Peabody from Forgewell Solutions, and I am here with Janet Salvador. And we are just going to talk about a couple of things that we've been seeing with our clients in the last couple of weeks. And I think Janet is an excellent source to kind of give us some background information on some of these developments. So thank you so much, Janet, for being here.
You're welcome. One thing Karen and I have noticed lately is, and it gave us some direction to do some work with people, is with all the stress that everyone has been under, it can exacerbate some difficulties in people. So when we see the type of issues that some people are having with inability to be in control of their emotions, or black and white thinking, or difficulties in relationships, and these are our clients that we're familiar with and we know their history. So if there's any indication of that they grew up in a dysfunctional home, then we start to look at how we can help these people learn how to regulate their emotions, because they do fit a certain category that has been labeled adult children. And this started in, I think, the 70s, that characteristics were identified, and it started as a result of some people who were aging out of Alateen, and they wanted something further. And one young person, Anthony Anonymous, identified a laundry list of 14 characteristics, and these are all readily available online. You can read the list, and many of them are, for example, perfectionism, or inability to tolerate anger or emotion, fear of rejection, or let me see, help me out here, Karen. What are some of them easily identified?
This is what I've been seeing a lot. Not knowing if they have the right to their feelings.
Yes.
You know, which that's the one that kind of triggered it for me, that I called you about. And I think it's important to know too that these aren't just like kind of personality types. These are things that are so ingrained in your personality that you actively really avoid them, or freeze up, or fawn up when confronted with it, or the thought that you might be confronted with somebody's anger or disappointment in it. So they're really quite painful, but they tend to go under the radar, and people don't suffer with them too much, because they built a life around them, protecting these kind of things. But now that everything has kind of been exposed, because they
really are adaptable behaviors that children learn in order to survive an environment that doesn't make sense. And so it really is a survival mechanism, an adaptable behavior. And so for a long time, these behaviors were recognized as a collection of traits. Meetings were formed, evolved from Al-Anon meetings, and they can be found. If a person wants to look them up, they are listed on the Al-Anon meeting list. And they're coded with a lowercase AC for adult children. And so those are available at adultchildren.org, where you can go in and find local meetings that right now, unfortunately, they're online, they're Zoom, but they are starting to open up. And so there is these behaviors, there's hope for people recovering from them, even though they are long-term and adaptable behavior. Because it's a behavior, it can be unlearned and different behaviors learned.
And so I think even just when we give people the information, like you know, based on your history and some of the things that you're talking about and the behaviors that you're really experiencing, they seem to fall under this category of adult children. I think even that's almost like a sigh of relief, like, oh, okay, like there's something out there that makes sense about this. This isn't, I'm just not like kind of coming apart at the seams.
Yes. Invariably, that's the reaction that I have seen when people have learned um, about this, to the point now it's called a syndrome. And so when people learn that there's other people who have had childhoods that didn't make sense, that were very difficult, and they hear from these other people that these are the kind of problems that they now have a hard time with in adulthood. And so there is a sense of comfort that they're not struggling with these issues all by themselves. Mm-hmm. So there is group therapy, peer therapy in 12-step meetings through Adult Child. That's one resource that's readily available. And there are, as I said, a lot of online, there's a lot of online information about this topic. And so we go from, once we identify that this is how we can help somebody, then it's, what do you do about that? And so we go from there to help a person identify their feelings. Sorry about the dogs in the background.
We're all adapting here.
Identify their feelings and just help them make sense of what they feel comes from trying to make sense of an issue that is senseless. And so as children, this is very, very difficult.
So is that what some of the things that you're doing with people when you start to...
Yes, because if you start trying to get a person to use coping skills and change their behaviors before you work on them healing their feelings, it's not going to work, because they're not able to do the coping skills if they still have the fears, for example.
Right.
If I still have the shame, if I still have the fear, then I'm not going to be able to set a boundary or to say no or to change my behavior. So first is to break through the denial and help people realize it's okay to acknowledge that this is what I'm having difficulty doing in my adult relationships, and maybe it comes from what I tried to take care of as a child, and it's okay to accept that this is why I'm having difficulty. And so it's
also the behavior was how they coped with chaotic home. Mm-hmm. So understanding, like, we can't just take the behavior away, because that was how they dealt with it. So
right. So and there again is another reason to find a group and find other people that they can talk to about this. It can be an individual therapist, and it can be other people in any kind of recovery groups, because there's the key word. It really is another issue that people can recover from.
Yeah.
And just as people recover from substance abuse and eating problems, and that if they're trying to fill a void with food or a drug or something else, that there's an issue there to recover from. So this is also something that people can recover from and learn to feel better, or actually be in touch with their feelings first, and change the standards they've been taught to live by. Quite often, it's okay to talk about what went on in my home, even though I was taught as a child to keep secrets, for example. So it's okay as an adult for me to develop my own set of values, standards, and morals.
Right.
So there's the recovery process.
Some people could be watching this and be like, "Oh, I wonder if this is me." You know what I mean? Of you kind of hear a whole bunch of symptoms and you kind of wonder. But I, want people to think about these things are kind of things within ourselves that like almost make you stop in your tracks. They're almost like intolerable. They don't fluctuate. They don't, they're really something that we tap dance around and avoid. So that's how painful it is. So there isn't really a whole lot of movement there. The
Right,
rigidness makes it part of the problem.
right, right. Exactly. And the rigidness, but inside there's the kind of severe emotional reactions to things at the
Yeah,
same time.
yeah. That the defensiveness, that's almost like the defensiveness of this wound that's really, really painful.
Mm-hmm.
That I think sometimes is so painful that they're not even in touch with.
No.
You know, it's not a place where they can go too often. So it's a little bit more challenging clinically to get to, you
It
know,
is.
but I think with everything going on in the world, it's really been exposed.
Mm-hmm. Yeah. And I I also think that it doesn't take long once a person starts to do this work to recognize some changes. So there's a lot of feedback that is supportive to the person, and they can see the results of being able to be in touch with their feelings and talk about that and make steps toward um, bringing this into their life and it takes courage to be able
Yeah.
to make these kinds of changes. Um, uh,
And
but
see,
the emotional development that happens is easily recognizable, and there's that positive reward people get, and that helps them get even more invested in getting better, so that they really do achieve emotional development.
yeah, and I think it spreads to other areas in their life where they
Mm-hmm.
didn't know
Mm-hmm.
this also was affecting them, you know, of it's just not this particular issue or feeling that starts to get better, but they
Absolutely.
see
Mm-hmm.
so many other things.
Yeah.
Well,
Yeah.
thank you so much. As always,
You're
it's a pleasure
welcome.
talking
And
about this stuff.
we're going to have a list of resources that you're going to post in your
Yes.
blog. That's wonderful. As I mentioned before, there are support groups and treatment for other issues that can come up with a person with this, uh, like substance abuse treatment or 12-step groups for other issues, family treatment, um, and as well as all the publications that are readily available. They're very, very interesting. It's a lot, and it can be overwhelming trying to figure out what direction to take. And I think that's where we can also help a person find some direction in, because no one has all 14 of these traits that I mentioned before in the laundry list. But it's sort of a person knows what they're having difficulty with. And sometimes it takes someone to help just give them a sense of direction too, and support.
Right, right.
Mhm.
So if people wanted to find you, Janet, how would they find you?
They just have to look up the website, Forgewell Solutions, and all the information is there, that they can find me and connect with me.
And you are at the office on Tuesdays, Wednesdays, and Thursdays. Right now we're doing telehealth, you know,
Yes.
um,
Mhm.
and we will continue to do telehealth for a little while now, but you're at the office Tuesdays, Wednesdays, Thursdays
Mhm.
when eventually life gets back to normal.
Yes.
All right. Thank you so much for being here. It was great to
Thank
see you.
you. And thank you for your patience with the dogs.
No problem. Likewise. All right.
Thank
Thank you,
you.
everyone.
Thank
Bye-bye.
you. Bye-bye.